Well, plastic surgery is a multi-billion-dollar business, especially here in California. And if you're thinking about a new you in the new year, you may want to hear about the new trends in plastic surgery for 2018.
I think we're all ears here. Joining us now is board-certified plastic surgeon Dr. Elliot Hirsch. Dr. Hirsch, thank you so much for joining us. Okay, so last year we saw a lot, the lips, big lips,
Sure.
very much on trend for 2017. So do you see any trends starting for 2018, and what are they?
No, absolutely. Now in 2018, we're looking at natural. Natural is the new in for plastic surgery. I think that the overdone look is out. People want to look like they've had the effects of plastic surgery without actually having anything done.
I love that. Well, what is the most requested plastic surgery procedure?
Non-surgical injectables and laser treatments, huge.
Wow, okay, well, let's talk about the injectables. Like, a lot of people get Botox, but is Botox still the popular, like, facial filler stuff, or are there other fillers that you like, or what do you have to say about those?
We think about in terms of what effect patients are going for. If you're looking for the smoothing of the fine lines and wrinkles in your foreheads around your eyes, Botox is the way to go. If we're looking at smile lines or smoothing of the contour of the mandible or the chin, fillers like Juvederm or Restylane, those are perfect.
On the radio, I hear about lasers and tightening your skin. Do they really work?
They do. You know, it's just a matter of what are your expectations, what are you really looking for here, but absolutely, they work very well.
Oh,
let's talk about if people get something done. Is there any kind of procedure done that might be a mistake that is irreversible, or are things reversible?
Well, to a certain degree, things can be corrected. At a certain point, though, if there's too much scar tissue, if there's actual damage to the nerves or muscles, those things you can't always be fixed, but the effects can often be masked so that people look like a little bit more natural.
What about men in your practice? Are you seeing that more?
Yeah, absolutely. Men, early in 2018, we've already seen several patients for Botox or Brotox, as it were.
I call it Brotox.
Very common.
That's funny.
Or gynecomastia, also very common in male breast development.
Oh.
Very easily corrected surgically. Patients are very happy with the results.
Wow.
Interesting.
Yeah. Okay, well, let's talk about I wasn't expecting that, to be honest.
Yeah, I know.
So let's talk about, are there certain patients that you discourage from having anything done, like age, or, I mean, like young? I feel like a lot of young people want stuff.
Everybody wants to look their best. Whether you're young or you're older, we have to make sure patients have a very realistic expectation for what they're going to do. And then more importantly, of course, is health. If somebody doesn't have the health, if they have a lot of medical problems, these people, we want them to work on these other things first, and then we can help them with the other stuff later.
Also make sure they're mentally and emotionally stable, I suppose.
Of course,
Yeah.
of course.
You
It goes
see
without
some
saying.
people, then it's like they can't stop.
Yeah.
It's an addiction or something.
Well, occasionally we do see that, and that's actually something called body dysmorphia disorder, and that's always in the back of our heads as plastic surgeons. We think about that when we see the patients to make sure that, again, we are doing the right thing, we're trying to help people, and we don't want to do anything wrong.
Good. No doubt about it. Dr. Hirsch, thank you so much for joining
pleasure.
us. Well, to learn more, go to his website at Hirsch-Plastic-Surgery.com.
I'm sure we'll bend your ear during the commercial break.
Sounds good.
I know.
Check with Jonathan Novak and see at the forecast.